I am Dr. Shashikumar. I am Secretary of Indian Association of Dermatologists, Venereologists and Nephrologists Karnataka branch. I welcome you all on behalf of IADVL Karnataka. October 29th is the World Psoriasis Day, which is specially dedicated to people suffering from psoriasis. Every year, we are conducting activities to raise awareness about psoriasis among publics. Renowned dermatologists from Karnataka will speak on this condition.
I am Dr. Venkatram, a dermatologist in Bangalore, immediate past president of IADVL, sending out this message on psoriasis on the eve of Psoriasis Day with the hope and wishes that this innovative program will give support to psoriasis patients all over the world. Psoriasis is a chronic skin disease characterized by silvery white scales on certain parts of the body such as elbows, knees, scalp, umbilicus, bony prominences, etc. It does not cause much itching, but it causes a lot of psychological stress. It is not a contagious disease. It does not spread from one person to other person. It can be diagnosed easily by a dermatologist. Any patient should contact the nearest dermatologist, take proper advice and follow the treatment. We should all support psoriasis patients by giving them moral support, scientific information and getting him access for proper modern scientific treatment. Spread this message of psoriasis is not a contagious disease.
Disabling and incurable skin disease which can be kept well under control with proper and timely medical care. More than 125 million people are affected worldwide, that is nearly 3% of Earth's population. It can present a scaly, red, itchy patches over certain parts of the body, and sometimes the entire body can be affected. However, it is not a contagious disease.
The exact cause of psoriasis is not known. There are many factors mentioned, like genetic factors, immunological factors, environmental factors. The cells of the skin in psoriasis, they multiply very fast to the tune of 10 times the cells of the normal skin. As a result, there will be red patches on the skin, and these patches will be covered by silvery white scale.
Psoriasis is a chronic skin disease causing severe physical and psychological disturbance to the patient. There are many treatments available for this disease. Good counseling, lifestyle change and good treatment will keep the disease under control and provide good quality of life.
Good afternoon to all of you. We know that on 29th October we are celebrating or observing rather World Psoriasis Day. The game IADVL is really making the day worth observing simply because we have to break the barrier for the people with psoriasis, and as there are many new modalities of therapies are there wherein we can improve the quality of life, we must help the patients with psoriasis. I wish the observation of this World Psoriasis Day a good coverage by media and also all the members of IADVL to take active part and spread the message that psoriasis and psoriasis people can have the best quality of life. Thank you.
Psoriasis is generally a restricted disease to the skin, but can involve internal organs. Among them, most often it can affect the joints when it is called psoriatic arthritis, and it can sometimes be crippling. Psoriasis has recently been considered as a disease where there is systemic inflammation.
Is known to be associated with comorbidities. Comorbidities are those diseases which commonly exist in people with psoriasis. The understanding is that the genetic basis for the psoriasis is also shared by those diseases which occur with it, meaning to say that the defective gene which causes psoriasis also causes the comorbidities. Now, what are these comorbidities? Up to 30% or 40% of people with psoriasis will develop arthritis, that is joint pains. So if you are a person with psoriasis and if you wake up with stiff joints in the mornings, or if any of your joints or tendons, meaning to say the place where the muscle joins the bone, if that area is tender or painful, you need to tell the doctor about it. Secondly, it is known that the metabolic syndrome is also more common in psoriasis. What is metabolic syndrome? It is an increase in body weight, that is obesity, increase in blood fats, increase in blood sugar, and increase in blood pressure. Hypertension, hyperlipidemia, diabetes, and obesity. This combination is called as metabolic syndrome. This is also more common in people with psoriasis. So if you are a patient with psoriasis and your doctor asks you to run a certain number of tests after checking your weight, it is perfectly valid. And if you have any of those conditions, your doctor may treat you or ask you to see some other person, some other doctor for these illnesses. Also, inflammatory bowel diseases, that is, diseases like ulcerative colitis and Crohn's disease are more common in people with psoriasis. So is uveitis, which is inflammation of the eye, and nephritis, which is inflammation of the kidneys. So when you go to a doctor and you have a diagnosis of psoriasis done, it is quite probable that depending upon the severity of your psoriasis and your age and the questions that he is going to ask you, for a list of tests to see if all you have is just the psoriasis itself or if you have any of the comorbidities. And if you do, he is going to treat some of them or all of them or refer you to a doctor appropriate for the organ involved. Thank you.
Psoriasis is a common non-contagious skin disease and it can be treated and maintained in remission by rational treatment through a dermatologist.
Phototherapy with modifications has been used in psoriasis in the last couple of decades. Phototherapy involves treating patients with ultraviolet light in scientifically designed chambers. It indeed is a boon and helps reduce the disease severity, the need for multiple drugs, and also improves the quality of life. This facility is available with dermatologists and also in hospitals all across the state of Karnataka.
I am Professor Raghunath Reddy. I am here to give you a small message behalf of World Psoriasis Day on 29th October from IADVL, Karnataka. Psoriasis is a simple and common skin disease. It is not communicable. Only skin specialists or dermatologists knows in detail about the disease. If you have psoriasis, kindly consult your nearest dermatologist and take treatment and advice and manage your psoriasis and live a healthy, happy lifestyle.
I am Dr. Chandrasekhar B.S., Chief Dermatologist, Cutis Academy of Cutaneous Sciences, Bangalore. Psoriasis is not a simply skin disease. It's a disease of lifestyle. It affects both joints and heart, along with cutaneous manifestations. We need to focus more on special groups of psoriasis like younger children, pregnant patients, and disease with polypharmacy, where patients of diabetes, hypertension, renal disease, heart disease having psoriasis. Dermatologists are the right people to treat psoriasis from its inception almost up to the cure status. Patients don't have to have loose hopes. There are a lot of new treatments available in the form of biologics, which almost puts lifestyle of psoriasis to a normal person. We as healthcare providers have to look into the lifestyle modification of patients, bring a lot of smile and to infuse a lot of encouragement in psoriatic pain.
Dermatologists are the doctors who understand the science behind treating psoriasis. We do everything possible to give a comprehensive care and a quality life for the psoriasis affected. from the Indian Association of Dermatologists, Venerologists and Leprologists, Karnataka branch, we observed World Psoriasis Day, that is on 29th October, and we are committed to achieve these goals.